managing erectile dysfunction is a very specialized job. Managing prostate cancer is equally a specialized job where you're going to remove a localized prostate cancer. What when both of them need to be combined? Looking at erectile dysfunction post radical robotic prostatectomy is an aspect that we have not touched too much. Something which we need to look at into the agony of individuals who are cured of prostate cancer and are still very young, who had hopes before, during, and after that they would continue to have erectile function, or the erectile function was changing because of reasons known to us, which brings about erectile dysfunction, namely diabetes, age-related changes, various other medications, neuropathies, etc. As I continue to do more and more localized prostate cancers by radical robotic prostatectomy, I get to see more patients with expectations where we need to match the expertise in terms of attempting to do a nerve-sparing robotic radical prostatectomy. But that expertise has to be matched by the disease which is already progressive, which has already involved the prostate, the capsule, the nerves out there. And therefore, the main motto while doing a robotic radical prostatectomy on one side is to clear the disease completely. While on the other side, looking at the individual who is young, who has got hopes, expectations, and for whom, once we bring about a cure of disease, as it's a specialized way that we do for robotic radical prostatectomy by a technique which I continue to do on the XI and the SI machine. We also look at individuals who come to me post-radical prostatectomy with erectile dysfunction, where the disease has been completely cured, but the erectile function never came back, or there's no erectile function to be able to be capable on the bed, which he was. These kind of individuals require penile rehabilitation, which obviously comes with a large degree of counseling and partner participation. Along with that, the stepwise approach towards medical management with the PDE5 inhibitors and possibly vacuum erection devices. Now, these do work in a subset of patients and individuals from different cities having undergone open or radical robotic prostatectomy in the era before, or undergoing it in the last 6 months to 2 years and failed to get the kind of results that they would get in their erectile function with either oral therapy or with a vacuum erection device and various kinds of rehab techniques, do come and request for a management of erectile dysfunction. The erectile dysfunction exactly is what it could be, as complex as it is, in individuals who are gracefully aging, and with that aging comes erectile function loss. Now, in these individuals, when we have opted to clear their prostate cancer, we have gone very close to the nerves. They've gone very close to the continence mechanisms and have finally cured them. So they're cured of a disease. But post-cure comes those kind of expectations, which actually helps them to reach out to specialists to get the erectile care and then incontinence care. So on one side, while I do robotic radical prostatectomy for localized prostate cancers in individuals in their 50s, 60s, and 70s, individuals in 50s and 60s do come from different centers saying that our erectile function and our continence or urinary control is on the poorer side. The two important factors as a reconstructive urologist and andrologist that I need to look into are incontinence of urine or leakage of urine, which happens post robotic radical prostatectomy, where now with various kind of mechanisms and surgical approaches on a reconstruction, we're able to bring back the continence mechanism or the control mechanism that they don't have to live on diapers. On the other side, they are individuals who have complete erectile loss and have not been actually able to get the result that they're expecting. So to match the experience of these individuals requires this expertise where we look at those patients getting erectile function back again by penile processes. Penile process is something which actually helps individuals to get the aspect of capability that they had or they ought to have or they expect to have, has actually come to levels where the results of the first few hundred patients gives us an idea that this could be a therapy for cure rather than only treatment. Patients look at getting treated on their erectile dysfunction to levels which actually help them to probably reach what they're aiming for. And that aim is something which I need to help more and more patients out. So as I said, erectile dysfunction in these individuals could be a little different from what it could be in individuals who are gracefully aging around. And penile processes have actually helped us out. To look at individuals who were in their 50s and 60s, having undergone radical prostatectomy, anything between 6 months to 5 years, and not having any capable erectile function, and actually succeeded on with penile processes. Similarly, individuals who are totally incontinent or incontinent beyond their capabilities on the diapers have successfully improved with the kind of care that we have been able to take them forward, either with an artificial sphincter or with a male sling. So when I look at these aspects of reconstruction, these aspects of rehabilitation, which as a urologist and andrologist we could give them, I think it's time to reach the public domain and make more and more people understand that this is completely happening. So why live on diapers? Why live without an erectile function, which you have possibly capable of in due course of time, and would gradually go down to people who are of your age group and who possibly will have this naturally. For you, you will never turn any more older because you will have an erectile function with a penile prosthesis, which actually is a kind of a standard of care for individuals who fail the kind of step ladder pattern on these therapies around. So for us as andrologists who come with an expectation for cure post radical prostatectomy, we always look forward to giving them a cure. Apart from counseling them and making them understand the capabilities, finally giving their organ a capability which they were capable of all the time and with the dream of, is penile prosthesis between you and your capability for future. So I think as news spreads, as more and more success stories go out from these clinics, more and more of andrologists who have been involved in this kind of a subject would probably take up this important rehabilitation of individuals who have been cured on a disease, but still waiting for a cure on another aspect of disease, which would keep them both mentally, psychologically, physically capable of. Erectile dysfunction is treatable. It is treatable in normal individuals who gracefully age and probably lose out to aspects which are changes, and therefore more and more diabetic patients require the kind of therapy which I'll end up doing called penile prosthesis, possibly because of the massive stage migration which happens in erectile dysfunction, in microangiopathy and microneuropathy, all these which happens around in prolonged and progressive diabetic changes around. Something which is not measured by the blood sugar levels. We measure our blood sugar levels every day and hope that things are going well. But unfortunately, there are these progressive changes happening which are irreversible. A classical example, like penile health is a barometer of man's health, which gradually goes missing in a lot of diabetics, a lot of patients who are on antihypertensives, a lot of patients who have got neurological diseases, spinal issues. I think it's time to look at penile prosthesis as not only rehabilitation, but a cure of bodies and minds and keeping them younger as they can always be, because the other disease has been cured. Friends, it's time for us to wake up to this important aspect and probably spread the word, because many people live in agony and disgust and probably not able to reach out to individuals who could get this cleared up for them. Thank you so much.